Okay, today we are talking nephrotic syndrome and contrast this with nephritic syndrome, where we hear itis, nephritic, but this is not nephritic. And so we're talking nephrotic syndrome, and nephrotic, notice in the word itself, syndrome, it's not a disease of itself. It's often associated with other conditions like diabetic kidney disease or FSGS or minimal change disease and others like it. And the primarily distinguishing feature of nephrotic syndrome is the ongoing loss of protein and the protein in the urine. And that should not be, because normally if you look at the diagram up here, this is the endothelial cell with the fenestrations or the pores and the basement membrane and the podocytes with the filtration slits and slit diaphragms. They are supposed to be small enough so that certain substances can go through, but not protein. And so when protein gets through, that's a problem. And if we look on the bottom here, this is another way of looking at it here. So there's the three layers, the fenestrations of the endothelial cells, the basement membrane, and the podocytes. If you have problems with any of these three or all three, now you're starting to get leakage of large proteins into the urine, including albumin being one of the most common ones. So the distinguishing features is number one, high amounts of urine protein excretion into the urine, on the order of 3.5 grams a day or 3.5 grams per gram of creatinine. Basically the same number, just a different way of different units. The second thing that's often characteristic is hypoalbuminemia. Now, albumin is one of the most common proteins in the blood, so that makes sense. You'll see that in the blood work that you'll have low protein levels. And what happens when you lose protein is, of course, water follows. So you get edema, you get peripheral edema, and in the lower extremities, primarily by gravity. But you could also have in other places, like some patients complain of periorbital swelling or swelling around their eyes even in the mornings. So those are three big ones. Now the fourth one may be a little bit more confusing, but it's hypercholesterolemia. People will have cholesterol numbers of up to 300, 400, and so that's surprising. So why is that? It's because the liver is upregulating the production of lipoproteins and just lipogenesis. And we oftentimes forget that HDL, LDL, VLDL, all these things are actually proteins, right? They're lipoproteins. And so it makes sense that the liver is trying to compensate by making more. So we will find that also as another sign. So those are four primary features of nephrotic syndrome.